there's really strong disagreement right now in our country about things. But the great thing is, down here in Southern Virginia, we've been doing it respectfully, and we've been having that debate. You know, there's a lot going on at the national level. Some of you know there were some forged letters sent to me by a corporate lobbying firm, things like that. That's not what's going on here at the grassroots level. People who disagree with me here are genuine residents of this community who have genuine disagreements with me, and that's what this democratic process is about. And I don't think we should disrespect anyone for whatever view they have and however strongly that they express it. I think what's important is that it's not about drowning out other views, it's about having that discussion. So yeah, there's some shady tactics that go on at the national level, and it's disheartening to see. And one of them has been this euthanasia issue. Euthanasia is illegal. It remains illegal. Not only are we not subsidizing it or requiring it, it's not even allowed. And any group that's out there telling seniors that we're going to pull the plug on them just is not telling the truth. Now, let me say what is in the bill and, get some feedback on how people feel about it. Because the passage that set this off is actually something that came to us from senior citizen advocacy groups, which is that right now what already happens is that seniors will sit down with a doctor and have a conversation about end-of-life care, living wills, do not resuscitate, other options. Most seniors really like this, and they like it for a variety of reasons. They want to know what their options are, and frequently they want to make that decision so that their spouse doesn't have to in a difficult situation. They want to have that conversation before it was in the emergency room. Problem is, generally speaking, we don't reimburse doctors for having that conversation right now. So what doctors are saying is we can't keep doing this if we're not getting reimbursed under Medicare. So this is about reimbursing for a conversation that already occurs. There's no conditionality that says you will not receive your Medicare unless you agree to a living will or do not resuscitate order. It's just not true. So this is a place where we can have a discussion. If people don't like having that conversation with their doctor about end-of-life care, that's an important thing for us to hear. But it's important that we're having that conversation about the facts of what are in the bill and not about the scare tactics.
I have in my hand about 20 letters or so from constituents in Danville, Pennsylvania County, and other places. And what should we know about reform that will actually do?
The point of what this plan is trying to create is not to tell anyone they have to take the public option. The idea is to give them the keys to a grocery store where they can go down that aisle and pick between a bunch of private insurance and there may or may not be a public insurance on that same aisle. We're not telling them they have to take that under this plan. The issue is people who currently either, for whatever reason, cannot get access to private insurance. The issue is how can we get them into that grocery store where they have to make a choice. So the idea of requiring anyone to take the public option is sort of against what the bill is about.